I'm Svina Brown. I'm the Outreach and Advocacy Coordinator for Oklahoma Policy Institute and the coordinator for Together Oklahoma. I'm here today with Carly Putnam, who's our Director of Policy and resident expert on all things healthcare, and we are here to talk about SoonerCare. So Governor Fallin signed an executive order and signed a bill into law instructing the Oklahoma Healthcare Authority to seek a waiver from the government, allowing us to end healthcare coverage for low-income parents who don't work a certain number of hours. And this is a little bit different because even though this was all signed into law, there's still a lot left to do. So can you explain what was done with those moves and what is still left to be done?
Yeah, the waiver development process for any Medicaid waiver tends to be pretty long, which is good. You want to have lots of transparency and oversight. And when the governor signed her executive order and the legislation, she really just authorized the healthcare authority to put together a plan to seek a particular goal, but without a lot of details built into that plan. And so now, with the legislative session receding rapidly in the rearview mirror, now the healthcare authority and the governor's office are hashing out exactly what goes into this plan that will then be submitted to the federal government for their approval before it can be implemented in Oklahoma. And there's a lot of steps into this process.
So who might potentially be affected by this new requirement?
That's a really good question, and it's one that we don't fully have an answer to yet. That's one of the issues that they'll be hashing out right now. We know that there are about 73,000 adults in the category of people that this work requirement could possibly apply to. But we also know that there will be a number of automatic exemptions, people younger than 19, people older than 50. Those are pretty clear-cut. We also know that there's expected to be an exemption for parents of children with disabilities, but we're not sure how that will necessarily be determined. We know there's supposed to be an exemption for people who are unable to work, but unable to work is a pretty broad term, and how that will be defined, we don't know yet. We don't know how often exemptions will need to be sought, and that's just an exemption. We still don't know what qualifies as work. We don't know how often work hours will have to be logged. We don't know what sort of accommodations can be made for people who work in jobs where they don't set their hours. We don't know what will happen for people who work largely agricultural jobs, where they may work a whole lot in one season and not have access to a lot of employment in the other. And we don't know what will happen to people who work themselves out of SoonerCare eligibility due to this work requirement. So SoonerCare coverage currently cuts off at about 46% of the federal poverty level for a parent. Her children continue to be covered at higher income levels, but the parent's coverage cuts off at what sociologists call deep poverty. But that same person can't go get coverage on on healthcare.gov until 100% of poverty. So we have this sort of coverage crater where people can earn too much to qualify for SoonerCare, but not enough to qualify for other coverage. And in these very low-wage jobs that people in this income bracket tend to work in, there's typically not employer-sponsored coverage available. So in the effort to get people to work themselves up into, a better situation, we could actually just be working them into losing access to really basic medical care. And so the state needs to have a plan for that.
So for people who care about this issue and care about all Oklahomans having access to quality health care, what should advocates be doing at this point?
Advocates right now should be contacting the governor and the healthcare authority and letting them know of their concerns. We also expect that we will have a draft of the waiver available for public comments probably in early July, and that's when we'll really get answers to a lot of these questions, see what's been kept in, but also are there people who have been left out? And that's when there's a whole nother opportunity for people to comment there. So I think throughout the summer what's really important is that advocates and people who really care about this issue are consistently making their voices heard.
Thank you so much for making some sense of this rather complicated topic. For more information, you can go to our website at okpolicy.org.